All right, let's dive into this Cathflo Activase prescribing information you sent over. It's quite the medical maze, wouldn't you say? Lots of technical terms and data, enough to make anyone's head spin.
It's true, it can be a bit overwhelming navigating through all that information.
But don't worry, that's why we're here. We'll break it down together, pull out the need-to-know info about this medication.
Exactly. It's all about making this information accessible. Knowledge, especially about healthcare, is empowering.
So let's start with the basics. What exactly is Cathflo Activase?
Think of it as a sort of microscopic plumbing crew for your veins. It's a clot-busting drug.
A plumbing crew, I like that.
The official term they use in the document is recombinant tissue plasminogen activator, or TPA, which sounds pretty complex.
It does.
But essentially, it's a protein that's engineered to break down blood clots.
Okay, so we've got our tiny plumbers ready to tackle those clogs.
Yeah.
But why is this so important when we're talking about central venous access devices, or CVOs?
Ah, good point. CVADs are those catheters you often see in hospitals. They're really lifelines for delivering medications, fluids, nutrition directly into the bloodstream.
Right. Those are essential.
Now imagine a clog in one of those lifelines. That's a major problem.
Definitely.
And that's where our Cathflo Activase comes in.
The tiny plumbers to the rescue.
It's designed to be injected directly into the clogged catheter to break up the clot and get things flowing smoothly again.
So instead of a pill you swallow, it's a targeted solution delivered right where it's needed. Pretty ingenious. And speaking of targeted, how effective is this stuff? The document mentioned clinical trials, and I'm always curious about those real-world results.
Now, this is where it gets really interesting. The document highlights 3 separate clinical trials, and the data is pretty impressive. For instance, one trial involved nearly 1,000 patients, and over 85% of them had their catheter function fully restored after using Cathflo Activase.
Wow, that is a high success rate.
It is.
But I'm guessing, like any medication, it comes with potential downsides too. The document did mention side effects.
You're absolutely right. There's always a balance of risks and benefits with any medical treatment. And yes, bleeding is the most common side effect, which makes sense given that it's breaking down clots.
Right. You want to make sure it's breaking down the right ones.
Exactly. The document points out that serious bleeding events are rare, but it's definitely something healthcare providers carefully consider for each patient.
It's about weighing those risks against the potential benefits, right?
Yes, exactly.
This is why that open communication with your doctor is so important.
Absolutely. It's about making informed decisions together. And speaking of informed decisions, the document goes into detail about how the drug is prepared, the doses for adults and children, even storage instructions.
That's all important.
It might seem like minutia, but in medicine, those details are critical. Getting it right can make all the difference.
It's like a chef following a recipe precisely to create a masterpiece.
Absolutely.
And that's what makes this deep dive so valuable, understanding not just the what of Cathflo Activase, but the how and the why. It's about gaining that 360-degree view. Now, before we get too far ahead, let's rewind for a second. You mentioned that 85% success rate, which is fantastic.
It is.
But was that consistent across all 3 clinical trials? Did it work equally well for different types of catheter blockages?
That's a great question, and it highlights a crucial point. Clinical trials often have very specific parameters. While the overall success rate was impressive, it did vary slightly between the 3 trials. For example, one trial focused specifically on catheters blocked with fibrin, which is a key protein involved in clot formation.
Right. It's all about that fibrin.
In that trial, Cathflo Activase was particularly effective, with a success rate closer to 90%. However, in another trial that included catheters blocked with other materials like drug precipitates or blood components, the success rate was slightly lower, around 82%.
Interesting.
So while the overall picture is positive, those nuances in the data are important to consider.
It's not just about whether it works, but how well it works for different types of blockages. It's about understanding the nuances, right? That's where the real insights lie.
Exactly. And it emphasizes the importance of thorough assessments and personalized treatment plans. It's not a one-size-fits-all approach.
Now, we've talked a lot about what Cathflo Activase does, but what about what it shouldn't be used for? The document mentioned it's not a first-line solution for just any catheter issue.
You're sharp. That's a really important point.
Thanks.
Just like you wouldn't use a hammer to fix everything, Cathflo Activase isn't the answer for every catheter problem. There are other potential culprits, like mechanical issues with the catheter itself, or it could be positioned incorrectly.
Oh, I see.
Even things like sutures constricting the catheter or buildup inside can mimic a blockage.
It's like detective work. You
Exactly.
need to pinpoint the root cause before jumping to a solution.
Precisely. And just like a detective wouldn't want to contaminate a crime scene, the document stresses avoiding excessive force when checking for blockages.
Makes sense. You don't want to make the situation worse.
Exactly. Forcing the issue could damage the catheter or even dislodge a clot into the bloodstream, which could lead to further complications. So careful assessment is paramount.
Speaking of potential complications, the document did touch on allergic reactions.
You're right. Just like with any medication, there's always a chance of an allergic reaction, even with Cathflo activase.
Right, and those can be serious.
And these reactions can range from mild, like hives or itching, to severe, like anaphylaxis.
Exactly. And while serious reactions are rare, it's crucial to be aware of the signs and seek immediate medical attention if they occur. It's always better to be safe than sorry, especially when it comes to allergic reactions. Now, we've talked a lot about adult patients, but what about children? Is Cathflo activase safe for them?
That's a great question, and the document does address pediatric use. One of the clinical trials specifically looked at children, and the good news is that Cathflo activase appears to be just as effective in restoring catheter function in kids as it is in adults.
That's reassuring for parents and caregivers to know.
It is. But as you might expect, the dosage is different for children.
Makes sense. Kids aren't just small adults.
You're right again. For kids weighing less than 30 kilograms, the dosage is meticulously calculated based on the internal volume of their catheter, but it never goes above 2 milligrams.
Wow, that's very precise.
So it's a highly individualized approach, even more so for younger patients.
So important.
Precisely. And it highlights that no matter who the patient is, the preparation and administration of Cathflo activase should always be done by a qualified healthcare professional.
This is not a DIY project.
Absolutely not. And speaking of handling it right, the document stresses proper storage too.
You're on a roll with catching those crucial details. Yes, storing Cathflo activase correctly is essential for it to work its magic.
It needs to be kept chilled and shielded from light, like a delicate flower.
Interesting.
And once it's mixed with sterile water, it has to be used within 8 hours. It's like a ticking clock.
It is. Every step, from storage to preparation to administration, requires precision and care. And that level of meticulousness makes sense when you consider that this medication is going directly into the bloodstream.
Right.
It's about minimizing risks and ensuring patient safety every step of the way.
Absolutely. Speaking of patient safety, one thing that struck me while reading the document was the emphasis on contraindications. It's like a big flashing warning sign. Do not use if.
Exactly. And the primary contraindication highlighted is if the patient has a known allergy or hypersensitivity to alteplase, which is the active ingredient in Cathflo activase, or any other component of the medication.
That's right.
So allergies are a definite no-go. What about interactions with other medications?
That's a smart question and something anyone who might be prescribed Cathflo activase should definitely discuss with their doctor. While the document doesn't dive deep into specific drug interactions, it does caution that using Cathflo activase alongside medications that affect blood clotting or platelet function could increase the risk of bleeding.
It's all about those clotting factors, isn't it?
Exactly. It's like a delicate dance between different elements in the body, and introducing a new medication can sometimes disrupt that balance.
And remember, this prescribing information is incredibly thorough, but it's not exhaustive.
Right.
The best source of information is always a healthcare professional who can consider your individual medical history, allergies, and other medications to see if Cathflo activase is the right choice for you.
It's about personalized medicine, tailoring treatment to the individual.
Speaking of personalized, I did notice the document mentioning that Cathflo activase shouldn't be used with catheters designed for hemodialysis.
Right.
Why is that? It seems like a specific exclusion.
That's a great catch. And it highlights the importance of understanding that not all central venous catheters are created equal. Hemodialysis catheters are designed differently than other types of central lines. They're usually larger in diameter and have a different flow dynamic.
Oh, that makes sense.
Using a clot-busting medication like Cathflo activase in these specific catheters could potentially increase the risk of bleeding or other complications.
So it's like using the wrong tool for the job.
Precisely. And it underscores the need for healthcare providers to carefully consider all factors before administering any medication, especially one that has such a powerful effect on the body's clotting cascade. It's about minimizing risks and maximizing benefits.
Now, before we move on to potential risks beyond bleeding and allergic reactions, let's take a quick pause to remind our listeners that we're not medical professionals here.
We're not, no.
We're your guides to navigating this information, but if you have concerns about your health or a specific medical condition, please reach out to your doctor. They are your most trusted source for personalized
Function could increase the degree more. It's a team effort with your healthcare provider leading the charge.
So, with that said, let's get back to our deep dive. One thing that really stood out to me in the document was the emphasis on patient safety. It seemed like every step, from preparation to administration, highlighted minimizing risks.
You're spot on. The document outlines very specific protocols for reconstituting the medication, the right way to inject it into the catheter, even how to dispose of any unused solution. And it really hammers home the importance of aseptic technique throughout the entire process.
Aseptic technique basically being super careful to avoid contamination, right?
Exactly. Even the tiniest bit of contamination could introduce an infection, which could lead to serious complications, especially when you're dealing with something going directly into the bloodstream. So sterile gloves, sterile needles, sterile everything.
Absolutely. The document doesn't mess around when it comes to safety,
It doesn't.
which is reassuring. It builds confidence knowing that these protocols are in place.
It does. It's all about ensuring the best possible outcomes for patients.
Speaking of outcomes, the document mentioned that some patients might need a second dose of Cathflo Activase. What determines if that's necessary?
It all comes down to whether that first dose successfully restored function to the catheter.
Makes sense.
The document recommends waiting a specific amount of time, about 120 minutes, after the first dose to assess its effectiveness. If the catheter is still blocked or not working properly, a second dose might be administered.
So it's not automatic, but a judgment call based on the patient's response to that initial dose.
Precisely. And the document is clear that exceeding the recommended dosage is not advisable. Safety first, as always.
Now, I'm curious about this fibrin specificity mentioned in relation to how Cathflo Activase works.
Okay.
It sounds very scientific. What exactly does it mean?
That's a great question, and it gets to the heart of how this medication works on a molecular level. Fibrin specificity means that Cathflo Activase has a particular affinity for fibrin, that key protein we mentioned earlier, that's involved in forming blood clots. Think of it like a lock and key mechanism. Cathflo Activase is the key, and it's seeking out those fibrin locks within the clot.
So it's a targeted attack, zeroing in on that fibrin framework of the clot.
Exactly. Cathflo Activase binds to fibrin within the clot and then activates another protein naturally found in the blood called plasminogen.
Okay.
This activation process turns plasminogen into plasmin, which is like a tiny Pac-Man that goes to town on that clot, breaking it down into smaller, harmless pieces.
I love that analogy. So it's a targeted approach, minimizing the risk of affecting other parts of the body.
Precisely. And this fibrin specificity is a major reason why Cathflo Activase is considered a relatively safe and effective treatment option. Because it primarily targets fibrin within the clot, it's less likely to cause widespread bleeding elsewhere in the body.
That's reassuring to hear. Targeted therapies, once again. Now, I know the document delves into how Cathflo Activase is manufactured, even mentioning recombinant DNA technology.
Right.
Do we need to break down the complexities of genetic engineering here? Or can we spare our listeners a full-on science lesson?
I think we can keep it high level for now.
Yeah.
The key takeaway is that Cathflo Activase is produced using a sophisticated process involving genetically engineered cells.
So not something you can whip up in your kitchen.
Definitely not. It requires a state-of-the-art laboratory setting and a whole lot of scientific expertise.
Cutting-edge stuff. All right, let's shift gears and talk about what happens after Cathflo Activase has done its job. Let's say the clot is gone, the catheter is working again. What's next?
Good question. The document outlines a few key steps that typically follow successful treatment. First and foremost, it recommends aspirating or drawing out a small amount of blood from the catheter.
To make sure it's flowing freely.
Exactly. This ensures the catheter is clear and there aren't any residual clots or obstructions. It's also crucial to flush the catheter with a saline solution to remove any remaining medication and prevent any further clotting.
Like giving it a good rinse after a thorough cleaning.
Precisely.
Oh, no.
And from there, the healthcare provider determines the best course of action based on the individual patient's needs and condition.
So it's not a one-and-done situation. There's ongoing monitoring and management involved.
Absolutely. Restoring catheter function is just one piece of the puzzle. The ultimate goal is to ensure the patient's overall health and well-being are being addressed. It's all connected. Now, we've talked extensively about the potential risks and complications associated with Cathflo activase, but before we wrap up this part of our discussion, let's end on a positive note.
Okay, I like it.
What are some of the key benefits of using this medication?
That's a great point. While we've delved into the potential downsides, it's important to remember that Cathflo activase can be a game changer for many patients.
It can.
One of its most significant benefits is that it's a minimally invasive procedure.
Right.
Right, as opposed to something like surgery, which carries its own set of risks and requires a longer recovery time.
Exactly. With Cathflo activase, there are no incisions or general anesthesia needed. It's simply injected directly into the catheter, which minimizes discomfort for the patient and often allows for a faster recovery.
So it's a relatively quick and painless procedure.
It can be, yes.
That's a huge plus. And because it works quickly to dissolve clots, patients often experience a rapid restoration of their catheter function, which is crucial if the catheter is being used to deliver essential medications or fluids.
Precisely. In many cases, Cathflo activase can help patients avoid more invasive procedures, like having to have their catheter surgically replaced.
So it can be a real lifesaver, both literally and figuratively.
You got it. It's a powerful tool in the medical toolkit, offering a targeted, effective solution for a specific problem.
And this idea of a targeted solution is really key here, isn't it?
It is.
It is, and it makes me think about the bigger picture of medical advancements. We're moving away from a one-size-fits-all approach and towards personalized, targeted therapies, and Cathflo activase is a great example of that.
It is.
It represents a shift towards precision medicine, and that's incredibly exciting.
It is. But, as with any powerful tool, it's essential to proceed with caution and careful consideration.
Absolutely.
We need to understand both its capabilities and its limitations.
Speaking of limitations, are there situations where Cathflo activase might not be effective?
That's an important question. While Cathflo activase has demonstrated impressive effectiveness in clinical trials, it's not a miracle cure.
Right.
The document is clear that it's only indicated for restoring function to CV80s. In other words, it's specifically for breaking down clots obstructing the catheter. It's not intended for treating other types of blood clots elsewhere in the body.
Right, so while it's a powerful tool, it's essential to use it for its intended purpose.
Exactly. And even when used appropriately, there's no guarantee of success. Some clots may be more resistant to treatment, and other underlying medical conditions might influence its effectiveness. It's always a complex equation that healthcare providers have to consider.
It's a multifaceted decision-making process.
Yes.
And it highlights why that open dialogue between patients and their healthcare providers is so crucial.
It is, yes.
Informed decisions are made when everyone has a clear understanding of the medications involved, the potential benefits, and the possible risks. It's a partnership, a shared journey.
Absolutely.
Speaking of shared journeys, the document mentions that Cathflo activase has only been studied in certain groups of patients.
Right.
What does that mean for people who might fall outside those parameters?
That's a crucial question, and it underscores a fundamental aspect of clinical trials. They're designed to test a medication or treatment in a specific group of people, and the results may not be directly applicable to everyone.
Right, so the findings might not be generalizable to the entire population.
Exactly. And in the case of Cathflo activase, the clinical trials primarily involved adults and a smaller group of children. There's limited data available on its use in pregnant women, for example, or in patients with certain underlying medical conditions.
So in those cases, it's even more critical to have a thorough conversation with a healthcare professional to weigh the potential risks and benefits on a case-by-case basis.
Absolutely. It all boils down to making informed decisions based on the best available evidence and individual patient factors.
Yeah.
It's about personalized medicine, tailoring treatment to the individual's unique circumstances.
Now, the document mentions that Cathflo activase is generally well tolerated by most patients, but what does that actually mean? Are there side effects beyond the bleeding and allergic reactions we've already discussed?
That's a great question, and it's important to differentiate between serious adverse events, which are relatively rare with Cathflo activase, and more mild side effects that might occur. The document does list a few other possible side effects that some patients reported during clinical trials. These include things like nausea, vomiting, mild pain or discomfort at the injection site, and a temporary drop in blood pressure.
Okay, so more like temporary discomforts rather than major medical emergencies.
Precisely. And it's crucial to remember that not everyone experiences these side effects. It varies from person to person, and often those side effects are outweighed by the benefits of the medication. But as always, it's essential to communicate any unusual symptoms or side effects to your healthcare provider. They can monitor the situation and make any necessary adjustments to your treatment plan.
Communication is key. It's about staying informed and proactive about your health.
Absolutely.
Now, before we move on to the next part of our discussion, where we'll delve deeper into some of the finer points of Cathflo activase, I want to leave our listeners with something to ponder.
Okay, I'm intrigued.
Well, we've talked extensively about how Cathflo activase is used to restore function to central venous access devices, which is obviously incredibly important.
It is.
But it got me thinking, what other applications might this clot-busting power have in the medical world?
Ooh, I like where you're going with this. You're thinking beyond the realm of CV8s.
Exactly. Could this targeted clot-busting technology be applied to other types of blood clots, like those that cause strokes or heart attacks? The possibilities seem almost limitless.
That's a fascinating avenue for further exploration. And it speaks to the incredible pace of innovation in medicine. What seems like science fiction today could very well be a reality tomorrow.
It's an exciting time to be alive, especially in the world of medicine. But as with any powerful tool, it's crucial to proceed with caution and careful consideration.
It is.
We need to balance the excitement of new discoveries with the responsibility of ethical implementation.
Wise words. The potential benefits of any new medical technology must be carefully weighed against potential risks.
Absolutely. So, on that note, I think we'll leave our listeners to ponder those possibilities, and we'll pick up our discussion in the next part of our deep dive, where we'll explore more of the nuances of Cathflo activase and its implications for the future of medicine.
Okay, we've covered a lot of ground about Cathflo activase, but
Yeah.
let's delve into some of the more nuanced aspects of its use. You mentioned those specific protocols for reconstituting the medication.
Right. Those details can be a bit overwhelming, but they're really essential for ensuring that the medication is prepared correctly and safely. The document outlines a very specific process for reconstituting the medication, making sure it's properly diluted and ready for administration.
It's like a precise recipe, isn't it?
It is, yeah.
One wrong step could affect the medication's effectiveness.
Exactly. And it really emphasizes the importance of using sterile water for reconstitution, which makes sense since it's going directly into the bloodstream.
Right.
It's about minimizing the risk of introducing any contaminants or bacteria. It's all about sterility and patient safety. And once it's reconstituted, the document emphasizes that it needs to be used within a specific time frame, right?
We got it. There's a time limit, usually within 8 hours after reconstitution before it needs to be discarded. The document stresses that the medication's effectiveness can, decrease over time.
That's like a fresh batch of bread. You want to enjoy it while it's still at its peak.
And I'm sure you're noticing that this prescribing information is very thorough.
It is.
It's about minimizing risks and maximizing benefits, all while making sure the medication is used as safely and effectively as possible.
It's a detailed guide for healthcare providers, and it's empowering for patients to have access to this information, too.
It is.
It gives you a better understanding of what's happening with your treatment. Now, the document mentions that Cathflo activase is fibrin-specific, which we touched on earlier.
Right.
It sounds like a kind of a key factor in its effectiveness.
It is, yeah.
Can you elaborate on what that means?
That's a great question. It really gets to the heart of how Cathflo activase works. The document emphasizes that it's not a generic clot buster. It's specifically designed to target those clots made primarily of fibrin, a protein that's, it's crucial for clotting.
So it's like a highly specialized tool that can break down specific types of clots.
Exactly. This specificity is what makes it so effective for restoring function to CVDs, where those fibrin-rich clots often form.
Right.
And because it primarily targets fibrin, it's less likely to cause widespread bleeding elsewhere in the body.
It's like a laser focus on a specific problem, minimizing collateral damage.
A perfect way to put it.
Yeah.
This fibrin specificity is one of the reasons why Cathflo activase is considered a relatively safe and effective treatment option. Now, the document also touches on the half-life of Cathflo activase.
Right.
It sounds like a concept from a sci-fi movie.
It does, kind of. What does it actually mean in this context?
The half-life of a medication is essentially the time it takes for the concentration of that medication in the bloodstream to decrease by half. So it's a measure of how quickly the body breaks down and eliminates the medication.
So it's like a countdown timer.
Not exactly a timer, but it does give us an idea of how long the medication stays active in the body. And according to the document, Cathflo activase has a relatively short half-life, meaning it's broken down and eliminated fairly quickly.
So it's a temporary solution, not a long-term presence in the body.
Exactly. That short half-life actually plays to its advantage.
Okay.
It means that the risk of prolonged bleeding or other complications is reduced because the medication isn't lingering in the body for an extended period.
It's a delicate balance, isn't it?
It is.
You want the medication to be effective, but you also want it to clear the body quickly to minimize potential risks.
Precisely. And that's where the beauty of, modern medicine lies. We're constantly learning more about how medications work and how to optimize their use for maximum benefit while minimizing, potential downsides.
Right.
So it's a constant evolution of understanding.
It's both exciting and a bit daunting, isn't it?
It is. But that's why resources like this prescribing information are so valuable.
They are.
They provide a wealth of knowledge and empower individuals to be more informed advocates for their own health and well-being.
It's about being a proactive participant in your healthcare journey.
Absolutely. And speaking of that journey, I noticed the document mentions that Cathflo activase has only been studied in certain groups of patients.
Right, it does.
What does that mean for people who might fall outside those parameters?
You're right. This is a crucial point. Clinical trials are designed to test a medication or treatment in a specific group of people, and the results may not be directly applicable to everyone.
That's right.
So the findings might not be generalizable to the entire population.
Exactly. And in the case of Cathflo activase, the clinical trials primarily involved adults and a smaller number of pediatric patients. There's limited data available on its use in pregnant women, for example, or in patients with certain underlying medical conditions.
Sure.
So in those cases, it's even more critical to have a thorough conversation with a healthcare professional to weigh the potential risks and benefits on a case-by-case basis.
Absolutely. It all boils down to making informed decisions based on the best available evidence and individual patient factors. It's about personalized medicine, tailoring treatment to the individual's unique circumstances. Now, the document mentions that Cathflo activase is generally well tolerated by most patients.
Right.
But what does that actually mean? Are there side effects beyond the bleeding and potential allergic reactions we've already discussed?
That's a great question, and it's important to differentiate between serious adverse events, which are relatively rare with Cathflo activase, and more mild side effects that might occur. The document does list a few other possible side effects that some patients reported during clinical trials.
Okay.
These include things like nausea, vomiting, mild pain or discomfort at the injection site, and a temporary drop in blood pressure.
Okay, so more like temporary discomforts rather than major medical emergencies.
Precisely. And it's crucial to remember that not everyone experiences these side effects. It varies from person to person, and often those side effects are, outweighed by the benefits of the medication. But as always, it's essential to communicate any unusual symptoms or side effects to your healthcare provider. They can monitor the situation and make any necessary adjustments to your treatment plan.
Communication is key.
Yeah.
It's about staying informed and proactive about your health.
Absolutely.
Now, before we move on to the next part of our discussion, where we'll delve deeper into some of the finer points of Cathflo activase, I want to leave our listeners with something to ponder.
Okay, I'm intrigued.
Well, we've talked extensively about how Cathflo activase is used to restore function to central venous access devices, which is obviously incredibly important.
It is.
But it got me thinking, what other applications might this clot-busting power have in the medical world?
Ooh, I like where you're going with this. You're thinking beyond the realm of CV/AIDS.
Exactly. Could this targeted clot-busting technology be applied to other types of blood clots, like those that cause strokes or heart attacks? The possibilities seem almost limitless.
That's a fascinating avenue for further exploration. And it speaks to the incredible pace of innovation in medicine. What seems like science fiction today could very well be a reality tomorrow.
It's an exciting time to be alive, especially in the world of medicine. But as with any powerful tool, it's crucial to proceed with caution and careful consideration.
It is.
We need to balance the excitement of new discoveries with the responsibility of ethical implementation.
Wise words. The potential benefits of any new medical technology must be carefully weighed against, potential risks.
Absolutely. So on that note, I think we'll leave our listeners to ponder those possibilities, and we'll pick up our discussion in the next part of our deep dive, where we'll explore more of the nuances of Cathflo activase and its implications for the future of medicine.
All right, we're back. We've journeyed through the ins and outs of Cathflo activase, from its intricate mechanisms to its potential applications.
What a fascinating ride.
And as we near the end of our deep dive, I can't help but marvel at how this medication highlights the incredible advancements in modern medicine.
It does.
It's like we're moving away from a one-size-fits-all approach and towards truly targeted therapies.
It's a fascinating evolution, and Cathflo activase is a prime example of this shift towards precision in medicine.
It is.
Instead of simply addressing a symptom, we're able to target the root cause, in this case, those fibrin-rich clots that can wreak havoc within CV80s.
It's about dismantling the problem at its core.
Precisely, and that's what makes this medication so compelling.
But as with any powerful tool, it's not without its caveats.
We've talked about potential side effects, the importance of careful patient selection, and the need for ongoing monitoring.
It's about using this tool responsibly and judiciously.
Absolutely. And that responsibility extends beyond the clinical setting.
You're right.
The development and application of new medical technologies like Cathflo activase raise important ethical considerations.
It's like opening a new chapter in the book of medicine, and we need to ensure we're writing that chapter thoughtfully and ethically.
You're right, those ethical considerations are crucial.
As we delve deeper into the realm of targeted therapies, we need to be mindful of potential unintended consequences, access disparities, and the evolving relationship between technology and healthcare.
It's a complex landscape, and navigating it requires careful consideration and open dialogue.
It's a shared responsibility between researchers, healthcare providers, policymakers, and the public.
And that's what makes these deep dives so valuable.
It's not just about understanding the science, it's about engaging in a broader conversation about the implications of these advancements.
It's about fostering informed decision-making and responsible innovation.
Precisely. Now, before we wrap up our exploration of Cathflo activase, any final takeaways you want to leave our listeners with?
You know, as we've journeyed through this prescribing information together, I've been struck by the level of detail and the emphasis on patient safety.
It's true, it is quite thorough.
It's clear that a lot of thought and research has gone into developing this medication and ensuring it's used appropriately.
Absolutely.
It's reassuring to know that there are rigorous protocols in place to guide its use and minimize risks.
It is. It speaks to the dedication of the medical community to constantly strive for better, safer, and more effective treatments.
And that's ultimately what it's all about, improving patient outcomes and enhancing lives.
Absolutely.
It's about empowering individuals with the knowledge and tools they need to take charge of their health.
Empowerment through knowledge.
It's about fostering a collaborative partnership between patients and healthcare providers.
It's a team effort.
It's about embracing innovation while remaining grounded in ethical considerations.
It's a delicate balance.
It's about recognizing that while we've come a long way, the journey of medical advancement is ongoing.
It's a continuous process.
Well said. And on that note, I think we'll wrap up this deep dive into Cathflo activase.
It's been a fascinating journey,
It's been an enlightening exploration of a truly remarkable medication.
and we've learned a lot.
And as always, we encourage our listeners to continue seeking knowledge, asking questions, and engaging in those crucial conversations about health and healthcare.
Keep that curiosity alive.
Remember, knowledge is power, especially when it comes to your well-being.
We're all in this together.
Until next time, stay curious, stay informed, and keep those deep-diving minds engaged.